and welcome to this podcast sponsored by the Center for Individual and Family Counseling. I am Dr. Pauline Jones Furman. I am the Executive Director and owner. My personal purpose is to inspire love, hope, and healing. During this entire month of February, every Wednesday, it is my desire to acknowledge and honor our essential workers. So today, I would like to express sincere gratitude and compliments to all of those in the nursing profession. My guests today are two registered nurses that I have invited to share their experiences during this pandemic, as well as how they are taking care of themselves. The title of the podcast today is Nurses Need Love Too, Self-Care in the Time of COVID. I would like to welcome Ms. Tovia Collins and Ms. Prentice Walker.
Thank you.
I am delighted that you have agreed to take this time out to share with my audience portions of your life that both professionally and personally have been touched by this pandemic. As you know, we are approaching the 1-year mark of overwhelming medical challenges that we have experienced not ever in 100 years in this country. Life for so many around the globe has been significantly altered, affecting our entire lives. Thank you so much for joining me. Ms. Collins, I would like to have you back up in time. And if you would please share any childhood memory that you have that connects your young life to your current profession.
Dr. Furman, I am humbled to be part of this discussion. Thank you. I cannot really say that, let me think a second. I can't really say that I have a specific childhood memory that goes back to attaching me to a stethoscope and a lab coat and Skittles as pills, and I can't really, I can't really say that I can go back. However, I do have a fundamental, basic memory of wanting to teach our people how to manage money and to actually use their money to make money, and to I actually wanted to have a business and just really empower our people. That's really my most fundamental, basic memory of a career. God obviously had other plans for me, maybe not a plan, but a vehicle, a different vehicle to do that. Because as a nurse, I still help people and empower people. I have an aunt that is a registered nurse. During my first year or two of college, she talked to me about a career in the medical field. And she stated that, Tovia, you really want to build a stable foundation. Your idea of a business and teaching our people empowerment regarding finances is wonderful, but I just think you should consider the medical field. So I tried it, and I'm here today. Nursing chose me. I didn't choose nursing. It chose me. It is a calling. I can't imagine doing anything else. I love it. It's my niche. And actually, I live in the community that I work in. I have taken care of my neighbors in various situations. As far as managing their care, I've actually taken care of them at the bedside in the intensive care, and I've actually saved lives on our block. So I'm called to do what I do. It's not a career, it's not a vocation. It's something that God has called me to do and empowered me to do. Mm-hmm.
Oh, Tovia, thank you so much for sharing. When I think about the calling, the desire to be influenced by your aunt, as well as knowing that God impacted your life tremendously, is amazing.
Yes.
So tell me, how many years have you been practicing as a registered nurse?
I have been a registered nurse since 1996.
Beautiful, beautiful. The impact in your neighborhood. So I'm assuming that you're well known in your community. Living and working in your community makes a tremendous difference.
Absolutely. You're vested. You know, I have a deep interest. It's not superficial. I care for the people that I take. I actually love to take care of the people that I see every day. They're part of me. I look at them and I can see my grandmother, my grandfather, my father, my mother, my uncle. So yeah.
Truly appreciate you sharing. And Ms. Walker, I would be extremely interested in hearing your earliest memory, if you have one, that connects you to your profession.
Well, I would like to focus on my family. I knew at an early age that I wanted to go into a helping profession, especially looking at nursing. I had some health challenges early on myself, and my mother was extremely nurturing, as well as some other members of my family. And my mother was a school teacher. So I vacillated between, am I going to nurse or am I going to teach? I wanted to be like my mom and teach, but I really had a passion for nursing. So what I decided was that nurses could teach, but a lot of teachers don't nurse. And if I would go into the nursing profession, I could do both. And that's what, I enjoy most. I enjoy helping people. I'm a very nurturing person. I like caring for people, and that is just my passion. And I always say that there's two types of nursing. There is a person that is made to nurse because it's their profession, and then there's a person that is a born nurse. And nursing has always come relatively easy for me because I feel like it was my calling. And I enjoy nursing and I enjoy teaching, and I'm able to do both, and that's what keeps me going.
Well, as I listen to you share and I think about your early childhood challenges and how you saw your mother care for you and demonstrate that love, because I think that that is what flows through the helping profession, the desire to show love, as well as the medical needs being met from every angle. So thank you so much for sharing. Ms. Collins.
Yes.
Would you please take this opportunity to share a little bit about your current position and your experience?
Do you want me to go back to the college years or just start with the current time?
Your choice, but give us a blend of both.
Okay. I started my academic career for nursing back in the 90s. I attended Oakland Community College, where I did my prerequisites. Then I progressed to Highland Park Community College. The graduating class of 1996, I was the actual last graduating class, period, of that college under the tutelage of Dr. Laney. I then took my boards, graduated, started working at a nursing home, East Grand Nursing Home, on the Boulevard in Detroit. I grew up, paid my bills, gave birth to a beautiful baby boy. I then progressed or advanced to the acute care setting, an acute care setting in the city of Detroit, which I specialize in ortho, neuro, and trauma. I then decided that it was time for me to move on to a higher education. So I decided to go to the University of Phoenix. And at that time, they had live classes face-to-face. I finished my bachelor's degree there. after which I decided to move on to other things, and that's how I ended up in the intensive care unit at the same hospital in the city of Detroit. I have been there most of my career, the intensive care unit. I did leave for a short stint to go to management, but then I decided that wasn't for me, and I ended up back at the bedside. So that's basically the progression of my academic and current career.
Thank you so much. Nurse Walker, take us through this blend of teaching and nursing. Give us your history and how you entered your career choice and blended the educational desire to teach, because I loved what you said. You wanted to decide, did you want to be a teacher? Did you want to be a nurse? And you knew that a nurse could be a teacher also, but a teacher couldn't be a nurse. So tell us a little bit more about your profession.
Well, I graduated from nursing school, and after getting out of nursing school, I went with a relatively large progressive organization and pursued nursing at the bedside. And I really enjoyed the unit that I worked on initially, and it was a unit where many of our patients could not verbally communicate well. So I took care of a lot of patients that had tracheostomies. And early on, I decided that I would write a book, a teaching book for the patients and family members, how to take care of their tracheotomy when they were discharged from the care facility. And it went over quite well. And I knew then that, well, I'm able to do both here. I'm able to do discharge teaching as well as develop a tool to assist with the teaching. And I've always done that in my clinical practice. So I've always taught, it's teaching from day one. We teach everybody, and I enjoyed that aspect. When I was done teaching in a long-term care facility
on this pandemic, what has been a little different for you, Nurse Walker?
Well, the thing that is different is that we have to still accomplish certain goals and get work done in a virtual manner. And we have to use whatever the person has to communicate, whatever tool it is. And we really, it makes you think more globally, because you can't just look at, well, everybody has a phone, or everybody has a smartphone, or everyone has a computer. That is not so. So therefore, if you have to meet people where they are, use whatever communication tool they have on board, and then work from there. And that is a challenge. But you know what? We have to get there because it's got to be done. So yes, it's been a challenge for myself as well as communicating with other people. But we're getting the job done. A lot of FaceTiming, if at all possible, and a lot of learning. So there's a learning aspect that's really prevalent, because if people don't know how to get to a destination or how to visualize things, you have to go over it and over again with them and make sure that they get it, and then you have to connect with them again, touch bases with them to see if they're really getting it and see how they're doing. And it's quite a bit, but we're getting there.
You are expressing all of the challenges that are currently going on as we look at this pandemic and how it has shifted things. We are in a virtual world, as you described. Nurse Collins, would you share any thoughts surrounding how things have shifted during this past year with this pandemic?
It's been a drastic shift. Back at the height of COVID, I was off for a few days. Prior to that, I think we had maybe 3 COVID patients in our intensive care unit at the time. I was off a few days. I come back. Our bed capacity was at 200%. I had never seen anything like that before in my life. Maybe in the movies, a horror story. It was just 200% capacity. My assignment, which is already overwhelming, had doubled. The patients were various ages. The news didn't really reflect that. It was just horrific, overwhelming, devastating. It was very emotional. There were times where I have to wear many layers of PPEs or personal protection equipment into the rooms. And you can only breathe so long before you feel a little sick yourself. So I could only spend so much time in the room, but it was just never enough. So I'd have to leave the room, sit down, drink some water, take a breath, take my equipment off, breathe a minute, and then I'd have to go back at it. After maybe the first weekend of that, I remember going home and I was just crying, unconsolably, just crying because it was just a little too much. The load, the patient load, the patient needs. And it was a lot. So I had to really gather myself because these people needed me. So I would go back, I'd maybe go to the bathroom, pep myself up. You know, Tovia, you were created for such a time as this. You can do whatever you have to do to take care of these patients. And then I'd go back out there and do it again. So I had to pause and just kind of gather myself. Do I have a moment to talk about? Okay, I watched the news this was during the height of COVID. I would watch the news 24 hours a day. I know that I shouldn't, but I did. And I noticed that the news really did not disclose the astronomical amount of deaths that were occurring in the city of Detroit, the national news as well as the local news. And I felt that there was something wrong. So I was telling everyone that would listen to me, look, this is really affecting a lot of Black and brown people, more so than any other community, but they're not reflecting this. I think a month later, that's when they disclosed that it was affecting mostly Black and brown people. But that brings me to another issue that I had, and that's why I'm so grateful to be here today. And that was, I did not see a lot of nurses who looked like me being interviewed regarding their experience, their discussion, their input, and their needs regarding the pandemic. I did see a lot of suburban hospitals being interviewed, but the bulk of the patients that were being affected was in the city of Detroit, the metro area. And these are not my words. These are the words of Dr. J, which is Dr. Whitmer's main doctor that assists her with this pandemic. So I'm just grateful that someone who looks like me has a chance to state what their experience is and was. Yeah.
Thank you, Nurse Collins, for bringing that to our attention.
Yes.
We have been drastically affected as a community. We have struggled with the facts and the fake news.
Yes.
We have been in the midst of it, and it is and continues to be very, very challenging.
Yes.
Nurse Walker, can you share a bit about your experience and how this pandemic has affected you?
Well, it's affected me in the sense that when my neighbors hurt, I hurt. And I look at it from a very global perspective in the sense that I have a intense understanding to not take it personal. It's not just me, it's everybody.
Yes.
And even with the patients that I take care of, it impacts them. You know, things are very, very different. They don't have the support that they can have and have had in the past. There's nobody present. There's no visitors. And they just have the staff, and their needs are great. So that's the perspective that I look at it from. And I struggle and toggle between, well, what about you? Are you taking care of yourself? And I try and still trying very hard, but there's something about it that just won't let me stop right now. Mm-hmm. And I can, but there's something about me, I just feel more needed than I probably am. And the patients, when you look at them and see what their needs are and know that they need help and they don't have anybody but you, it just makes it very difficult for me to just walk away. There's not enough time in the day for me to spend, working. I could work constantly, 24/7.
Yes.
But I can't do that and take care of myself and be able to take care of anybody else. So I struggle with that. So true. That's how it's impacting me.
Thank you so much. Mm-hmm. You are pushing me into the second half of what I want to discuss with all of the listeners that are tuned in today is how nurses and how you see your colleagues taking care of each other. And we'll get to that, but I like the idea that you know how important it is that you take care of yourself. I know that oftentimes you may be last, but it is so critical and so crucial that the helping profession, specifically nurses who are really in the trenches right now, focus on self-care also.
Yes.
Nurse Walker, I wanted to ask, how would you describe your students as they are embarking upon the helping profession in this medical field during this pandemic? What is it that you see in them that you want to share?
Well, I see that they're afraid and ambivalent about what, is this something I need to do? They need me, but is this where I need to be? And there's a lot in the media surrounding, the nursing helping profession as well as other helping professions, but nursing especially. And I just try to drive home with them that, they're needed, it's important, we need to learn how to do this. People are gonna be getting sick over and over again until the end of time. Mm-hmm. And they need people to care for them. And even if they decide not to go to the bedside and care for someone in a hospital facility or extended care facility, I tell them that they need to learn how to do this so that they can take care of themselves, mm-hmm. or it could be a family member or anyone else. So I'm just embarking upon, delivering the knowledge to them, because knowledge, without knowledge, you don't change behavior. Oh. So if you don't know better, you can't do better.
So true.
So I just keep teaching and trying to, inspire them to, just hang in there and, keep going. And, this is going to end. It's not going to be the same always. And you will be ahead of things, mm-hmm. if you have the knowledge.
Absolutely true. When we think about education and who our teachers are, because last week I had educators on, how impactful a teacher can be. You may not remember their name, mm-hmm. but you can absolutely remember what they taught you in terms of how you felt. So that educational piece is so critical. Nurse Walker, one more question. Mm-hmm. Can you tell me what you would describe as the most important technique that you want your students to embrace as future nurses?
I want to instill in them a mindset that you must be professional at all costs. And if you start right there, you will always respect people. You will treat them with dignity. You will be caring, compassionate, and concerned. Mm-hmm. And you will deliver whatever it is that you come to achieve with them with excellence. And in addition to that, to be prepared, because I tell them so many times, if you are not prepared, you're not going to be able to execute anything that you go to do. Mm-hmm. And one of the principles that I instill in them, preparedness promotes efficiency. And people don't want you to care for them if you show up unprepared, and from head to toe. So it starts at home. You have to prepare yourself physically, mentally, and emotionally before you go into any job to take care of others. Because people will look at you and say, you needed to take care of yourself today. Look at you. You're a mess. You don't want that to say. You don't want that. So it starts on the outer and also in the heart, on the inner. And your body language is extremely important. So those are the things that I try to instill in them that is not in the textbook. It's just not there. And, that's what I like to instill in them. Professionalism, respect, treating patients with dignity, compassion, and concern.
Thank you so much. I think when we start there, we're on the right track. We're going to take a moment for a break, and we'll be right back.
Okay, thank you.
SF Hardy presents Dancing Monkeys in My Soup. While on vacation in Peru, Jabbar discovers pygmy marmosets dancing in his dinner suit.
There's something in it!
Leaving the family alarmed and confused. Wow. They don't know how to get the monkeys out of the soup. Do you? SF Hardy, literacy advocate, author, and founder of Get Litty Family Reading Readiness Program, presents Dancing Monkeys in My Soup.
Here at Felt Smart, we challenge the mind and awaken the senses through every fun felt experience.
I'm gonna make pineapple and broccoli cheese pizza.
The Pizza Eco Wall provides a variety of games that teach math, memory,
with a yummy cheesy twist.
Toddlers love to play
peekaboo
while discovering the hidden treasures on the Lift-A-Flap Eco Wall. They will strengthen their memories, learn animal recognition, cause and effect, all while making cute animal sounds.
A ballet dancer helps children talk about good touch and bad touch with comfortable, fun activities for everyone.
Why go outside today, Layla? It's gloomy.
The Weather Palace teaches children to observe the weather, drip, drop, and then decide what is the best way to dress for today.
Be smart, feel smart, felt smart.
Welcome back. This morning, I am delighted to have 2 registered nurses present on this podcast to share about Nurses Need Love Too, self-care in the time of COVID. I have Nurse Tovia Collins and Nurse Prentice Walker. So once again, we're going to resume, but I'm going to share a little bit about what I see going on in my office. I know that this has been a difficult year for so many of the patients that I treat, that their anxiety, depression, grief and loss issues, isolation, overwhelming stress, and fear have just been significant. I have had so many patients who have lost parents, grandparents, aunts, uncles, cousins, spouses, children, and siblings that has also affected a number of their friends. We are looking at a devastating virus that has really consumed and affected so many families. It has been challenging. The devastation of many families has just stretched our communities to the brink. One of the principal difficulties has been with my patients not being able to connect with their loved ones for support following a loss or devastating illness. The sadness has been tremendously painful for so many. The inability to get a hug, to get a kiss from someone that you love and care about has been distressing. This is where our nurses fit right in, because they have been those first responders. When you may have dropped a family member or a loved one off at the hospital and you can't go beyond the door. Yeah. This is where our nurses have shown up and shown out in their facilities to provide that compassion, that love, that attention, that medical care for so many. The mere loss of physical connection has been a huge deficit. Nurse Collins.
Yes.
Would you please express how COVID-19 has affected you personally?
COVID-19 has affected me greatly. I lost my grandfather last summer, but he fell and was hospitalized during the height of COVID. It was very difficult to get an ambulance to come and pick him up because it was not a serious enough issue for them to come right away, so it was a wait. But I don't think, he fell and broke his hip, I think, on a Friday or Saturday. My beautiful grandmother held her husband hostage, quote-unquote hostage, at the house for a couple of days. So, he broke his hip. I knew that when he went to the hospital, there weren't going to be any specialists that could really clear him to have surgery, hip surgery at that point. So I decided to just let him stay. And that Monday, we really couldn't get an EMS to come to pick him up. So we loaded him up in the back of a truck, took him to the VA hospital. The VA hospital at the time said that, we will take him, but we will have to transfer him to receiving hospital because they had turned the VA hospital into a COVID hospital. So my grandfather was there for several weeks, came home. He never walked again, and he passed away in that June. So it was very difficult. I had to deal with that situation, plus the really heavy impact of the COVID crisis. So I lost him. Now I am heavily involved in making sure that my grandmother is managing well. I don't really have any concerns of her catching COVID because she hardly lets me in the house, well, at least at the beginning. And she would wear her N95 with me. And she has a sink full of soapy water with bleach. So anybody that comes into the house has to wash their hands with the soapy water and put on a mask. So she's very thorough. So I think she's going to outlive us all. She is 93. My grandfather was 95 when he passed. So it's difficult making sure that she's safe. My uncle lives there with her, so he's older, and we just have to make sure that when it is a multi-generational house, that everyone is practicing safety things to minimize the risk of the COVID virus. My son and I reside together, and he's, very young, in his 20s, and he's still out and about. So I practice social distancing in my home. When he comes in the house, he has to use a hand sanitizer, take his shoes off. If we are going to be close, he is required to wear a mask, or I will wear a mask. So that has affected me. Dating is a little bit more difficult. I have run into men who, after maybe one conversation on the phone, they don't want to Zoom or do any FaceTime. They just want to meet immediately. And I'm like, we are in the middle of a zombie apocalypse, so I'm not really into anything that fast. And then there are men who I've run into who said, you know what, you cute and everything, but you work in the where? Intensive care unit, and you work in the COVID area. I'm sorry. I know nurses need love too, but I'm gonna move on. So it's been very difficult dating. So I have a cousin, Nicole, who's really good at managing Zoom and setting that up for for the family. So I've been in a couple of Zooms, and I do a lot of duos and FaceTimes and things like that with my aunt. I have not been traveling. I am an avid traveler. I usually go out the country once a year, and I haven't been. So I feel like I have cabin fever. So it's difficult. I'm making the most of it, but my ultimate goal is to survive and to make it on the other side of this, because there is an end to this virus. And if you still have breath in your body, you can rebuild, you can renew. So that's my focus.
Thank you so much for sharing, particularly the dating piece.
Yes.
As we think about the differences in some gentlemen versus others. So I like Zoom, I like Duo, I like FaceTime, I like all of those things to be able to utilize in this new virtual world.
Yes. It's a wonderful tool.
I love it. Nurse Walker, how would you say this virus has affected you personally?
Oh, well, first of all, I'm going to have to speak to the many, many people that has contracted COVID and moved on. And they're not even here to talk about it. Young and old, and people that are as close to me and people that aren't as close to me. I see it. I get it. I'm able to connect the dots. And I have worked very hard at making sure that I teach people that, you need to social distance. You don't need to be in large gatherings. And you just have to be very, very careful, because it does not discriminate at all. And that is something that a lot of times people don't get, I'm healthy, I'm well, I'm strong, I'm, a male, or I'm a female, or whatever excuse that they want to say or use to make them exempt from getting COVID. It's just not there. And with myself personally, I am such a loving and touching person, and just hugging, and I just hug everybody, and it's just hard. It is so, so hard. And I just ask God, just put your arms around me, because I need a hug today. And I have to say that, but that, I'm very cautious as far as, being involved with people. And I am working. I'm very careful at work, But when I come home, you don't want to let COVID in.
Right.
You don't want to go pick it up either.
Yes.
So therefore, you just have to be extremely careful. You can't, when you talk about getting intimate with a person and them being in your face,
Mm-hmm.
It's something to think about if they don't live in your household
Mm-hmm.
and reside with you, and it's not something that has to happen, then it probably shouldn't.
Right.
Because if you really enjoy that and want to do those things, in time, it'll happen.
Yeah.
But now is not the time. So you have to be very, very careful. I had said to myself, well, if I'm going to ever be intimate with anybody, they're going to have to be COVID tested and everything else, and everything has to be in order. But, I don't know. I know that as long as I stay healthy and maintain precautions and make sure that the people that are in my immediate circle are practicing the same thing, we'll be here to talk about it.
Absolutely.
And I tease my brother all the time because he is really, really anal with it. I mean, when he comes to my house, he's going to have his glove on, he's got his N95 on, and he's going to take his shoes off and everything. And I tell him all the time, when this is over, nobody's going to be left but you and Dr. Fauci. But anyway, I try my best to maintain the precautions that is in place.
Thank you so much for sharing, and I love the relationship between you and your brother as well. Nurse Collins,
Yes.
if you would please share what you see different about death in the hospital versus pre-COVID.
Before COVID, we had deaths, but it wasn't cold. It was warm. Family was around. We could make the family comfortable with death. There was support for the patient in the transitioning of their passing. But since COVID, it's very cold. It's very difficult for family to see the decline, maybe, of the condition of the patient. It's very difficult for them to let go. It's cold. It's almost frozen. I know that the patients and the doctors and the nurses, we do FaceTime with the family, but it's not the same. It's just not the same. It's just so cold. It's very difficult. I do what I can to make sure that patient is not physically by themselves when they pass. But it's very difficult. I remember at the height of COVID, we lost so many patients so fast. It was just unreal. We would lose so many patients in a shift. There were so many cold blues. And most times you could save someone. But this virus is so virulent, so strong, and so dynamic. They would be gone by the time you put your hands on them. It's just unreal. So it's been very difficult. The process is different. It's just unreal. It's something that I will never, ever forget, and it's something that I have to process. And sometimes it's more difficult than others.
I have had a few of my patients share the losses that they've had. One specific case was where a young woman, 39 years old, married at 21, had 2 children by her first husband, divorced at 24, remarried at 27, had 4 children with her second husband, and they adopted a child. So we're talking about a house full of young people under the age of 18. The father indicated that he needed to take asthma treatment. Everybody was watching TV. He went into the bedroom to take the asthma treatment. The wife heard him get in the shower. He took a shower. He got out. He texted her from the bedroom to come to the room. And she's wondering, why is he texting her from the bedroom when he could have just called her name? When she got to the bedroom, he said he couldn't breathe. And so she asked him, did you want me to call EMS? He says, no, you can take me. She called her sister. Her sister is an RN. Sister said, get him to the hospital right away. Yeah. This is COVID. She was able to drop him off, but not able to go in. So she waited for communication from the hospital to let her know how he was doing. He was communicating with her from the waiting room, waiting to be admitted. And so he was admitted. This was a Sunday evening. He was still having difficulty breathing. However, the next morning they had indicated that he was COVID positive, but he could recover at home. That was a 7 a.m. call. She was en route to get him. At 7:30, he had passed. So within less than 24 hours, she had lost her husband and the father. 19 days later, her father died of COVID. So it has impacted, that's just one case. But I have had so many patients who have had losses that this has been so devastating for so many.
Yes.
Nurse Walker, family members have not been able to visit their loved ones in the hospitals, nursing homes, rehabilitation settings, and assisted living facilities. We know that this has taken a toll. I know that you wrote a book helping family members. What would you say to family members today who are unable to visit their loved ones in those facilities?
Well, first of all, I would say that my apologies for them not being able to be there with their loved ones, but try to reassure them that we're doing the best that we can and we're here for your loved ones, and that we will keep communication going as much as possible. You know, we'll FaceTime them and allow them to maybe see their loved ones, virtually. But I would also want to stress with them the importance of you don't need to be here. Because, we get into the fact that, you could be a carrier, you could get something from here and take home and infect several other people. They don't understand the magnitude of the virus. It's airborne.
Yeah.
It's airborne, which means that, you have to be protected and you have to have adequate protection from the virus. And the thing is, even with adequate protection from the virus, you can still contract the virus and pass it on. And we cannot have you in a situation where it endangers you as well as your loved one that we're trying to care for. And that's what is most important. And I think that, they get it if you, just remind them of it, because it's just extremely important that we, do our part to not, keep the virus
spreading.
Yes.
I'm just really kind of emotional about it. I've had several nurse friends that has contracted the virus, and it's not the same. And afterwards, they're not the same. And we don't know what the future holds, but we know that, it's going to be a ripple effect.
Yes.
And there's things that's going on that they haven't, said, and probably won't say,
Right.
And if we're here, 10 years or 20 years from now, we'll learn things about the virus that we still don't know today. So, we just have to be careful, and make sure that we do whatever we can, to help people with the process.
Yes.
Thank you. This podcast was developed to share and support those in the nursing profession. So now I would like for you to explore how you each take care of yourselves. I'm looking for the self-care tips that you can give to other essential workers, specifically nurses, to be their best selves. So the title of my podcast was that nurses need love too. Self-care in the time of COVID. So please give us some tips that you embrace that can be so helpful to everyone else. Nurse Collins.
Yes. So circa 2020, I loved going to spas. I loved cruising. So that was my self-care. But since then, I've really gotten into meditation, prayer and meditation. It is just awesome. You are just able to take off all of the heaviness and stress of your day through prayer and meditation. I have even last week, I've started to go into a quiet area room in the hospital that's where we keep equipment. I put a couple blankets on the floor and I sit there for a moment and I meditate. Just takes 5 minutes. You don't have to be in a certain area or a certain position. I do that, and I've also gone to taking old school Epsom salt baths once a week. I make my bathroom like a spa. That was something that I really stopped taking time to do. I take time to just rest. If I am physically tired, I sleep. There's nothing more important. It helps the immune system. I make sure that I hydrate. I drink water more often than I did before. I take supplements. I take vitamin D. I take vitamin C and zinc daily in addition to other supplements. Also, I'm a big believer in counseling. So that is something that's important. And also, I reach out to family every day. But another thing that I do is music therapy. I play different types of music. It really lifts. It's a quick lift in your mood and spirit. And I also do scent therapy, so different scented candles. So those are some of the things that I do to manage my stress. And
Beautiful, beautiful. Thank you so much. Nurse Walker, do you have any tips that you would like to add?
Yeah, everybody's a little bit different, and I know we enjoy different things, but I just have to do things that I know will help release endorphins in me. One habit that I have that probably isn't so good is those picking up COVID pounds from eating, things that I know that are good. I don't eat anything but good food now. It's like I am not going to waste my calories on things that, I don't particularly care for.
Amen.
But on the other side, I want to make sure that I'm eating good food nutritionally. Because, the body needs that in order to, be strong and fight off this virus.
Thank you for sharing.
I soak my feet. I get my hair done. I get my nails done. I have to do those things for me because, when you are nurturing all day long, you need to do something yourself.
yes.
Your tips are fabulous from both of you. Thank you so much for expressing them. And I would like to close with, as Ralph Waldo Emerson stated, to know that even one life has breathed easier because you have lived. This is to have succeeded. Thank you so much for sharing this morning. Nurse Walker, Nurse Collins, you were phenomenal. I appreciate you thoroughly, and keep on going, pressing forth. Thank you.
Thank you.
Thank you.
Appreciate you.